Hello everyone and welcome back to the Meet the Members series. Today we have with us CIMTI. So please could you introduce yourself and tell us what CIMTI does?
Thank you very much for this invitation. I am Elisenda Casanelles, Chief Operations Officer at CIMTI, which stands for Center for the Integration of Medicine and Innovative Technologies. And CIMTI is promoted by l'État and supported by the Department of Health from the Catalan government and ACOS, which is the Catalan Agency for Health and Quality Evaluation. The CIMTI's mission is to promote innovative projects in the health and social fields in order that high-impact innovation can reach the system, the Catalan health system, and can benefit citizens. Pretty much we function as an accelerator. So we provide services to project teams that we support in order to help them mature and advance throughout the healthcare innovation cycle.
Okay, sounds good. And well, how does CIMTI function?
Well, we have calls where teams can apply. If they do that, we will evaluate them with independent experts and we will select the best projects to enter our impact system. The best projects are those that have a higher potential of creating an impact. And by impact, I mean being able to change or improve patient care. Regarding our calls, it's worth mentioning that we've got two types. The CIMTI Innovation Call support any project team that is developing any health and social innovation in general terms. Whereas we also have the CIMTI Challenge Call. This one opens once a year, and here we prioritize together with the health department one challenge that CIMTI can help solve.
Okay, sounds good. And well, which kind of entrepreneurs could be interested in participating in CIMTI's calls?
Entrepreneurs must take into account the type of product that they are developing and their stage of maturity. So from one hand, we support project teams that develop either medical devices, in vitro diagnostics, or digital health solutions. Mm-hmm. And from the other hand, the maturity level must be within phase 2 and 5 from the healthcare innovation cycle. This is more or less equivalent to TRLs. The TRLs levels that measure technology, but in the innovation cycle, we also take into account clinical, market and business, and regulatory maturity. So phase 2 is idea, phase 3 is proof of concept, phase 4 is proof of feasibility, and phase 5 is proof of value. So if entrepreneurs are within this stage of maturity, they can apply to CIMTI.
Okay, let me ask you, what makes CIMTI stand out from the others?
I would say that what really makes CIMTI stand out is that we are an instrument from the Catalan government, as I already said. Mm-hmm. I said that CIMTI is promoted by l'État and supported by the health department and ACOS, which means that our strategy and purpose is aligned with the needs from the Catalan health department. And that means that CIMTI's positioning is at the very center of the Catalan health and social innovation. This positioning has facilitated us from the beginning to build a very strong network of connections with hospitals, primary care, institutions such as CatSalut or the Fundació TIC Salut i Social, and social institutions, among others. And in turn, what's relevant for the entrepreneurs in our program is that we provide access to such stakeholders. And that has proven to be very valuable for teams.
Okay, and what has been CIMTI's biggest success or biggest failure?
Let me start by the biggest failure, although I don't like to call it like that because it's something we haven't achieved yet, but I hope we will. Which is being able to invest in projects. Mm-hmm. So what have we achieved? We are very, very proud to say that we allocate a great percentage of our annual budget, to provide services to support projects through our network of experts. So far we have invested 3.5 million in supporting projects, but we'd like to go a step further and raise some funds that we could directly allocate to the best projects. So that's a work in progress. And the biggest success, I would say, is the strength of the public-private partnership that we have established to operate CIMTI. It's not easy to build from scratch an innovation instrument, promoted by a private entity such as like that, and supported by the Catalan government. There's a lot of stakeholder management involved and a lot of effort put into giving the teams. We promote valuable services. So we're proud because we did the first collaboration agreement in 2017 for 3 years. And in 2020, we renovated it for 4 years more. And the intention from all parts nowadays is that CIMTI is an instrument that was born to stay. And that's not easy to achieve because it has taken a lot of effort from the beginning up to today to maintain our good results and outcomes.
Okay. And well, what made you join Barcelona Health Hub?
Well, I have known for a while some of the promoters of Barcelona Health Hub. In some of our meetings, we discussed that we should collaborate. And one day they proposed, you should join, CIMTI should join Barcelona Health Hub. And we actually said, yeah, and you should also join CIMTI's network. So we basically both joined each other's networks to help connect startups with other relevant actors, because there's several startups that are both in Barcelona Health Hub and CIMTI, and we realized that we share some of the same goals, which is promote startups in digital health. So that's what we decided to collaborate, and we joined each other's networks.
Sounds good. And well, what do you expect from us towards the future?
I think Barcelona Health Hub has done an amazing job at giving visibility to digital health innovators from Barcelona, and what I expect is to continue doing that, given that the ecosystem is growing. There's more players every time, so there has to be room for everyone, events that allow connections between them in a way that there's useful. And I also like, or I also expect to increase the international visibility that the fantastic innovation that we have in Catalonia needs, and to show that this innovation can help promote patient care worldwide. And I think that Barcelona Health Hub has the tools and the connections to show and spread this in an international level.
Okay, well, is there anything else you would like to tell us that we haven't asked you?
I think it's fine. It was very nice to talk to you.
Okay, thank you very much for your time.
You're welcome.